I'm Renee. I'm Dr. Gazelli's physician assistant and second pair of hands during surgery. You are getting ready to have a posterior cervical decompression. Today I'm going to review the procedure and recovery time with you. Please feel free to take notes. I'm happy to go over questions that you have or go over more detail with you face to face. This is not meant to be comprehensive, so I do expect that you'll have questions, but hopefully this gives you a good amount of information on the procedure and recovery time. So on the day of surgery, you'll be arriving at either Rose Medical Center or Cherry Creek Surgery Center. You will arrive 2 hours prior to the surgery at Rose Medical Center and an hour and a half prior to the procedure at Cherry Creek Surgery Center. We do operate at both of these facilities regularly, so we have a consistent team of anesthesiologists and surgical teams that we work with regularly. Initially, you'll be brought back into the pre-op holding area. This is where nurses will start an IV and get things prepped and ready. They'll make sure all current medications or medical history is updated in the computer. You will meet the anesthesiologist in the pre-op holding area. Sometimes they call you the day before the surgery. So if you get a call that day before from a number that you don't recognize, you may want to pick it up because it could be that anesthesiologist just wanting to chat with you a bit and get to know you a little bit. You will, of course, also see Dr. Gazelli before surgery in the pre-op holding area, so he can go over any final questions that you have at that time. As far as the approximate time and family expectations, a one-level decompression should take us about an hour and a half to 2 hours. If you're having more than one level, feel free to add about 20 to 30 minutes extra per level. We are happy to keep any family or friends or whoever's there with you updated throughout the procedure. The nurses in the operating room can call them and keep them updated. Dr. Gazelli will also call them and come see them after the surgery. If they're there at the facility, he'll go and sit down with them face to face. And if they can't be at the facility, that's okay. He can call them on the phone and talk to them about the procedure and update them on how you're doing. As far as what happens in the operating room, you've probably already reviewed the procedure video, so you have a good idea of what's going to happen, but I'll recap it here and we'll go over a few frequently asked questions. This procedure is done under general anesthesia, and we also have people in there monitoring your spinal cord and spinal nerves during surgery. So after you're asleep, they're going to put little baby needles all over from head to foot, and that will monitor the nerves in the spinal cord during the surgery. So if anything starts acting abnormally, they'll let Dr. Gazelli know right away. I mentioned them to you as well to warn you in case you wake up with pinpricks, bruises, and bleeding. That's what that was from. The other thing with this procedure is the positioning. Because we're going to be working on the back of your neck, we do want to keep your head stabilized. And in order to do so, we do put tongs in your head that is actually attached to the bed. And so you'll end up with 1 or 2 holes on either side from those tongs. Those are placed when you're asleep and they're taken off when you're asleep, so you will not remember that they were there. However, there is a little bit of ointment, betadine antibiotic ointment that'll be in your hair right around those little spots where the tongs were in. I also like to mention them because on occasion one of those little tong spots might bleed a little bit. And if it is bleeding, we sometimes will have to put a little staple in there, so there may be a staple that needs to be removed. Once we have things positioned, the incision is made in the back of your neck, and it could be in the middle or it could be off to one side depending on if we're just going to the right or the left side. We'll move the muscles aside to get down to the spine, and we'll bring a microscope in as needed to do the decompression over the spinal nerve roots. So the whole focus of this surgery is to decompress or take pressure off of these nerves. So we'll remove some bone and make a window above the nerve, and that allows that nerve to have more room to float around in. We'll remove any overgrowth or anything that's pinching the nerve root. Once that we're confident that the nerve is floating free and in a much happier space, then the surgery is over and we can go ahead and close the incision. The incision is closed with layers of dissolvable stitches. Typically the top layer is a dissolvable stitch as well. It looks like clear fishing line if you or anybody sees it. There will be a little loop knot at the top and the bottom typically to hold tension on the wound while it's healing, and that will be trimmed off at your first post-op visit. I will also put little white skin tapes or steri strips on the incisions. You'll see that on the back of your neck, and all of that can get wet in the shower. Once the incision is closed, then we'll put a collar on you, and this is typically a soft collar, and then wake you up. Once you're getting awoken, you'll be transferred over to the recovery room. And in the recovery room, the nurses there will watch you and monitor things as you're waking up and becoming more alert. They'll help control as much pain as possible if needed. And sometimes we even put a drain in after surgery just to get that little initial ooze off of the wound in the area. So if there is a drain, the nurses in the recovery room will watch it, and as long as it's very little drainage, the drain will be pulled out before you go home. Now, if for some reason the drain was draining a little bit more than we were comfortable with you going home, but you were all ready to go home, you can actually go home with that drain. So on occasion, we've sent a patient home with a drain that was really ready to go home, and we would just have that patient come back in the office the next day and we'll remove it here in our office. As far as getting you home and discharging you from the facility, we'll be able to do that once you're awake and alert, you're able to get up and walk around, your pain is relatively controlled, and once all of those things are happening, then we can get you home. We do like for you to have a pain medicine and a muscle relaxant at home for you to use as needed. Oftentimes we'll try to give you those prescriptions ahead of time at your pre-op visit here in the clinic so that you can fill those ahead of time. That way nobody needs to worry about going to the pharmacy the day of surgery. So hopefully you'll have received those ahead of time and they'll be waiting for you at home. You can take over-the-counter medications starting about 2 days after surgery, but otherwise you can use the prescriptive medicines that we give you as needed. You can always use heat or ice over the bandage if necessary. We do give you antibiotics during the procedure, so we do not send you home with antibiotics. It should just be the muscle relaxant and pain medicine that you'll be having at home. Typically a 1 or 2 level decompression is an outpatient procedure and you should go home the same day. If for some reason you are spending the night at Rose Medical Center, we do have a spine and orthopedic floor that you would stay on, and there are spine nurses and physician assistants that work there regularly with our patients. If you do stay overnight, physical therapists and occupational therapists will work with you while you're there. You will typically be in a gown most of the time that you're in the hospital, but you're welcome to bring a comfortable, loose fit clothing to wear or at least to go home in. You're also welcome to bring any toiletries or necessities such as those from your home to the hospital. All rooms at Rose Medical Center are private, so you wouldn't share a room with any other patients. If you do spend the night, you would see Dr. Gazzelli or myself on a daily basis. If for some reason you were there over the weekend, you would see Dr. Gazzelli or myself or one of our other surgeons or physician assistants that might be on call that weekend and taking care of all of our inpatients. As far as what to expect initially and restrictions that we place on you, your activity is really walking as your main therapy. We want you moving and walking in alternating positions. I do not want you bedridden or chair-ridden after this surgery. So if you're just sitting around watching TV at home or reading, please get up every 45 minutes to an hour to get up and walk around, maybe just around your home, get a drink of water, go to the bathroom. If it's nice out, feel free to take little walks throughout the day. And I like multiple little walks throughout the day rather than one long walk that just wipes you out. As you're feeling more up to it, you can change those to fewer longer walks. But that will be your main form of therapy and exercise the first 6 weeks. Other physical restrictions, we ask that you not do any lifting more than about 10 pounds and not much overhead activity. We will give you a soft collar to wear really as needed. You may want to wear it at night more often because that's when you can get your head in a funny position without being aware of it because you're sleeping. And the first few days you may end up wearing it a little bit more regularly, but otherwise it is there for comfort. As far as showering goes and wound care, you can shower and get the incision wet as of the 2nd day after surgery, so about 48 hours. And how you'll do that is go ahead and take the outer gauze bandage off of the wound, get in the shower and shower like normal, letting the soapy water trickle down the back of your neck. This will allow it to cleanse it a little bit. Just don't let the water pound on the incision, don't scrub on the incision, and don't soak it in a pool or a bathtub. So once you're done with the shower, you just pat it dry and then put a new clean gauze bandage over it. The main goal is to keep it clean and dry. No ointments, creams, lotions, nothing like that is necessary. With the medications that you'll have been given during the surgery, as well as any pain medicines you take after surgery, these things can cause some constipation and slowing your belly down. So as long as you're on pain medicines, we typically recommend that you take stool softeners regularly. Of course, step it up to laxatives if the stool softeners weren't enough. And if you switch over to diarrhea, then go ahead and stop all stool softeners and laxatives. As far as driving goes, we ask that you not drive as the driver for the first few days up to maybe the first week, dependent on the amount of pain medications you're taking. We really want to get some of that general anesthesia and stronger meds out of your system. And if you're still taking medications as far as pain medicines or narcotics during the daytime, you should not be driving. We can discuss that further at your first post-op visit if you haven't started driving by then. So for work, we do ask that you take a little bit of time off of work. For this procedure, office, sedentary type work, you could get back to work within about 5 to 7 days. And as soon as you're comfortable working from home, you're of course welcome to do that. And when you do go back to work, you may want to consider the first couple of days, maybe up to the first week, only going back part days, because a full day of work may just wipe you out and make you really tired. But you can increase your time at work to full hours as you're comfortable. For those of you who have more physical jobs, like construction workers, you're probably going to be out of work a little bit longer as we restrict you for 6 weeks with physical activities. And then we want you to get yourself strong again with physical therapy before we would release you to full duty. So you could get back on light duty within that first week or so, but then as far as going back to full duty for physical work, it might be closer to about 10 weeks or so. As far as any complications or other things to expect after surgery, incisional pain or numbness around the incision is always expected from disrupting the skin and the muscles. It takes about 4 to 6 weeks for the soft tissues to heal, so it could be some soreness and some tightness in the back of your neck. And this is typically your post-surgical pain, is that back of the neck muscle disruption pain. And that's why we give you those muscle relaxants that can be very beneficial when the muscles are tensing up back there. And oftentimes those muscle relaxants will help better than just the pain medicines. But that's to be expected, to have that muscular post-surgical back of the neck, even into the upper back shoulder blade area. That's all normal kind of post-operative pain. Sometimes you'll even have symptoms continuing into the arms. So once we take the pressure off of the nerves, now the nerves need to heal, and they do heal slowly. It can take weeks and months for a nerve to fully heal. So while that is in process, it's normal for you to still expect to see some type of symptoms. Our hope is that your preoperative symptoms are much improved, if not resolved after surgery, but at least they're less frequent and less severe. And you may even have good days and bad days, where some days you just feel it a little bit more than another. And that's all normal, as long as it's up and down, but overall getting better. That's a normal expectation after surgery. On a rare occasion, a nerve gets a little aggravated that we were in there, however. And in those cases, the patient could wake up with the same level, if not increased level, of nerve symptoms into their arms. If that were to happen, we'll use some medicines to calm down that acute inflammation and pain or symptoms, with some steroids potentially, or nerve stabilizer medications. And there's one particular nerve we like to talk about, which is the C5 nerve. That nerve comes out at C4-5, so if you're having surgery at C4-5, we definitely want to mention this to you, that occasionally that nerve gets aggravated, and it's the most easily aggravated nerve root in the neck. And people can wake up with what we call a C5 palsy, where they have significant weakness in their shoulder and bicep. If that were to happen, we'll monitor you very closely, and we'll use those medications again that will help calm down that inflammation and stabilize that nerve. People, of course, worry about paralysis because we are operating around the spinal cord. With this procedure, we typically are not directly unroofing the spinal cord. In most cases, we're just unroofing the spinal nerve root. but occasionally we'll decompress part of the spinal cord as well. We're very slow and meticulous, and like I said before, we use a microscope so we can see everything nice and clear. So it really limits any irritation to the spinal cord because we want to be very slow and gentle around it. We'll also have those neuromonitoring people in there keeping an eye on things as well. As far as when to call us, any changes or worsening symptoms, increasing weakness, pain, numbness, tingling, things of that nature, please let us know. As I said before, it's normal if you have some symptoms residual, but they kind of come and go. But if they're getting worse and not improving, please let us know. Any increased or persistent fevers, I should say, increased infection signs around the incision, those types of things we want to hear about. So increased redness, swelling, drainage of the incision, fevers you're having, things like that that aren't getting better, please let us know. And any persistent nausea or vomiting we can help out with medication, so please let us know about that as well. As far as when you will see us next, we typically will see you back at your first post-op, which is about 7 to 10 days after surgery. At that time, we'll remove any sutures or staples if there were staples in there. We will review how you're doing in general, refill medications if necessary. We'll get x-rays at that visit and review those x-rays with you. And typically by this appointment, if you haven't already started driving, you should be able to drive because you should probably be off of the pain medications. But we'll discuss that in detail with you at your first post-op visit. We will then see you back at your 6-week post-op visit, at which time we'll start getting you involved in physical therapy and advancing activities. So as far as getting you back to normal, at 6 weeks, like I said, we'll start physical therapy and we'll give you an order for this, and this will help start strengthening these neck muscles again. In conjunction with that, you can gradually increase your lifting and your normal activities. The physical therapist can help guide you in getting back involved in your normal exercise program, any sports or physical activities that you like to do. So hopefully this has given you a good amount of information about the procedure and the recovery period, but please feel free to call us or email us at any time should you have any further questions or concerns. Thank you.